Hello, I'm Sunil Kripalani. I'm an associate professor of medicine at Vanderbilt, where I direct the Center for Clinical Quality and Implementation Research. I'd like to share with you today some of the work that we're doing to improve healthcare value through quality and implementation research. This is the value equation. In healthcare, the value of services is a function of the quality of care provided compared to the cost to provide that care. Recently, the Commonwealth Foundation compared the United States healthcare system against 10 other industrialized countries. This report found that although the United States ranked 5th in terms of quality, we actually were rated last in access, equity, efficiency, healthy lives, and overall. Other work has looked at healthcare spending as a function of gross domestic product. In this graph, we can see that the United States, the top line, is spending twice as much as other countries for healthcare delivery. So in terms of value, we could say that the United States healthcare system performance is average at best, but we're spending twice as much. That sounds like a low value proposition. There are a lot of efforts to improve the value of healthcare delivery. One of the efforts that's been implemented at Vanderbilt is to establish the Center for Clinical Quality and Implementation Research. The mission of our center is to advance research on the quality, safety, value, and delivery of care through scholarship, service, and education. A lot of what we do concerns implementation science, which is the scientific study of methods to promote the systematic uptake of research findings and other evidence-based practices into routine clinical practice, and hence to improve the quality and effectiveness of health services and care. By definition, implementation science is relevant to real-world clinical care delivery. It concerns what's feasible and sustainable. It concerns how to best implement practices that have proven to be effective and how to de-implement or stop doing practices that we know are ineffective. One example of how my center is working to improve healthcare value is through partnership with Choosing Wisely initiatives. Choosing Wisely is a national initiative of the American Board of Internal Medicine Foundation in collaboration with many professional societies. Here at Vanderbilt, Choosing Wisely initiatives are led by a team of house staff in collaboration with a faculty advisory committee. My center is partnered with Choosing Wisely initiatives to study the de-implementation of daily laboratory testing and daily chest X-ray utilization. Just to give you an example of what this work looks like, when the Laboratory Reduction Initiative was developed, it included the creation of educational materials like this, which provide the evidence that daily laboratory testing is not necessarily beneficial for patients. It highlights the harms of doing that practice. It questions the expectation that we should be doing daily labs in all our patients. And it asks healthcare professionals to just think, does my patient need labs in the morning? This initiative was rolled out through educational conferences, and it was coupled with weekly data feedback to show teams how they were doing in a bit of a friendly competition against their peers. We partnered with this initiative to evaluate its effect on laboratory testing rates at Vanderbilt University Hospital. What we see here is that just through this one example of laboratory testing, the basic metabolic profile, during the baseline period, testing rates were very stable on services staffed by medical residents. After initiation of an intervention and during a subsequent follow-up period, we demonstrated there was a significant reduction in daily laboratory testing rates on the house staff services. It was important to establish controlled services, concurrent services that were not receiving the intervention, because in this type of work, it's often not a randomized controlled trial. So part of the scientific rigor of these evaluations is to define a comparable control group that did not experience the intervention. And here we showed that the controlled services had very stable testing rates during this entire period of time. I'll note that this work has been led by Wade Imes, one of the chief medical residents at Vanderbilt, and is being published in Academic Medicine. Our second partnership involved chest X-ray utilization in the ICUs at Vanderbilt. Every day, chest X-rays account for more than $1,500 of expense in ICUs. Are they all necessary? Through another educational initiative in partnership with the directors of the ICU, the physicians and nurse practitioners in those ICUs, we implemented an intervention to question the practice of ordering chest X-rays, particularly in patients who were clinically stable. My center partnered with this initiative to evaluate its effect on chest X-ray utilization in the ICUs. In our preliminary findings, we've shown that during a pre-intervention period, chest X-ray utilization was quite stable, but after initiation of the intervention, utilization rates started going down. One of our medical students at Vanderbilt, Pierce Trumbo, rounded with the teams, understood the chest X-ray ordering practices, and made suggestions for how to improve the intervention delivery. And for his research elective, he helped us achieve additional reduction in chest X-ray use in those ICUs through his direct observations of practice and partnership with the leadership in the ICUs. As we continue to expand the Center for Clinical Quality and Implementation Research, we have a number of core faculty who comes from the schools of medicine and School of Nursing. Our expertise includes quality improvement evaluation, patient safety, and implementation science. In addition, there are another 40 affiliated faculty with the center. This is part of a large effort at Vanderbilt to improve the value of healthcare delivery and to generate scientific evidence in the process. If you'd like more information about our work, please feel free to email me. I look forward to hearing from you. Thanks very much.